Welcome to this tutorial video. So as you can see in today's session, we'll be looking at a very interesting topic which is generally referred to as the body tissues. Now, I know that most of you are already familiar with these concepts, but those in college, those in universities, there is a specific type or level of understanding that you need people to attain as we talk about body tissues. Before we even continue, remember to subscribe to this YouTube channel so that as we upload various notes, as we upload various videos explaining various types of notes on different topics, you are well updated. Now back to the topic. So we're going to be talking about body tissues, right? I know it's already clicking in your mind that when you combine different cells, when you combine cells, you'll be able to come up with a tissue. That is true, right? So to start with, you know that a cell is a basic functional unit of a living organism, right? And then when you combine cells of the same type, or nature, you'll be able to come up with a tissue. So that's what we'll be looking at today. That's what we'll be looking at in this particular session, body tissues. So specifically those who are studying health-related programs, it's very important that you have full knowledge and understanding of various body tissues. Why? Because, for example, I can give an example. You find yourself in a situation whereby you are withdrawing blood from a patient. They will ask you to maybe withdraw blood for various specific tests. What you need to understand that blood is it's a tissue, right? It's a type of body tissue. Okay. For example, some of you will be maybe required to be able to give an injection. Okay. When you're giving an injection, you're going into the skin, into the muscles, different types of injection giving methods. What you have to understand that you are penetrating through different body tissues, and then you must have understanding of the physiology of how those different tissues operate. Sometimes you find yourself in a situation whereby you're taking care of a patient who has got wounds, or maybe a patient who was bent, and then you find that maybe the skin was scraped off, it was removed, maybe the bone had broke, there was a fracture and everything. What you need to understand is that these different components I'm talking about are basically made up of what we call tissues. Just like the way when you introduced human anatomy, you talked about structural organization of an organism, where you move from the cell, you go to the tissue. From the tissue, you go to organs. From the organs, you go to systems. So it's very important to understand that if there is a problem in body tissues, then definitely there's a problem where? In organs. So in this particular session, we just want you to understand the physiology and anatomy of these various body tissues that we'll be looking at. All right. So this recap I'm giving you is just trying to remind you that as you are talking about body tissues, it's very important, because remember, a human being has got different systems. And these different systems are coming, or they're being made from different organs, and these organs have got specific tissue that are forming these particular organs. So it's important that we start or give you a recap on how it's, or where it all starts from. So it starts from the cells. The cells are the basic functional unit of a living organism, right? When you combine cells of the same type, not different cells, right? You can't combine the cells in the skin and that of blood cells to be able to come up with blood tissue, no. So you must be able to combine cells of the same type. So cells of the same type, if combined together, they will be able to form a tissue. So a tissue is basically a group or set of similar cells that perform specific functions. So this is the area of concern. We'll be talking about body tissues that are being formed by various body cells. Of course, I know that you know that from the tissue, you'll be able to move to be able to form an organ. For example, the stomach here. Then this organ will be able to combine with other different organs, of course, specific ones, to be able to come up with the system. For example, you can see that when you combine the stomach with the intestines, with the gallbladder and everything, esophagus, they come up with the digestive system. And then when you combine these different systems, for example, you combine the digestive system, the cardiovascular system, respiratory system, and other systems in a human being, you come up with the actual human or organism. But the area of interest today is on body tissues. Right? Yes. So in the introduction, we're saying that body tissues are the fundamental units that make up organs and systems in the human body. So body tissues are the fundamental units that make up organs and systems in the human body. What we mean is that you can't go to an organ without a tissue. You must first combine these different tissues to be able to form an organ. Then once you form this organ, you combine it with other organs, you come up with a system. That's what we're saying here. So understanding their structure and function is essential for healthcare professionals, especially nursing and midwifery. Of course, this includes also other fields of health, medicine, biomedical science, physiotherapy, and all those different components. It's important that you've got knowledge and understanding of how these of the physiology and anatomy of these various body tissues. So, for example, we're saying that whether monitoring wound healing. Remember, I talked about wound healing in the introduction. You may come across patients who have got wounds, those people that were injured. Okay? What you must know that there was damage to body tissues. So, whether monitoring wound healing, administering injection, solid grasp of tissue anatomy enhances clinical decision making and improves patient's outcome. So if you understand how body tissues operate or their physiology and their anatomy, it's important for you, it's easy for you to be able to give appropriate care to this patient who has got a wound, to this patient you want to administer an injection on, because you understand how the tissues are structured. Where are they? What do they do? If I do this, what will happen to them? Even in somebody who has got a wound, for example, if the wound is producing pus, you'll be able to tell that there is damage to body tissues, and you'll be able to make proper, clinical reasoning, okay, or proper decisions. That's what we're talking about, right? So this session is going to explore the 4 primary tissue types and their relevance in everyday health practice. So as you saw from the introduction, I talked about a topic being body tissues. The topic is body tissues. But what you need to know is that as we make progress, we'll look at different types of body tissues. All right. So the general objective of this particular video session is that you should be able to acquire knowledge on various body tissues. And of course, on the main focus. All right. On the main focus, you've seen that I've not moved from the general objective to specific. Why? It's because when you are talking about body tissues, they are of different types. They are of different categories. So there is what we call epithelial tissue, right? There is what we call epithelial tissue. There is what we call connective tissue. There is what we call muscle tissue and nervous tissue. So these are the 4 main classes or the 4 major types of body tissues that you find under human anatomy and physiology. And you must be familiar with each and every type of tissue that has been highlighted here. Epithelial tissue, connective tissue, muscle tissue, and nervous tissue. So not to miss out, ensure that you subscribe to this YouTube channel because we'll be explaining notes and important aspects on each and every type of tissue that we've talked about here. Now, we are going to focus on the functions, characteristics, as well as types and clinical application of each of the above mentioned body tissues. So for you to say I'm equipped with knowledge on body tissues, you must know what epithelial tissues are all about, their functions, their types, their clinical application and everything. Then you must also do the same for connective tissue, muscle tissue and nervous tissue. Now, in this particular session, we're going to start with the epithelial tissue. We'll talk about epithelial tissue, everything that you need to know about epithelial tissue, and then we're going to do the same for other body tissues. All right. Now, talking about epithelial tissues, that's from the word epi. Epi meaning like on top, like on surfaces, all right? Being on top, right? So that is epithelial tissue. So if you are talking about epithelial tissue, what I need you to know is that if they ask you, what is this epithelial tissue? How is it different from connective tissue? How is it different from nervous tissue? How is it different from muscle tissue? What should be coming in your mind first is that if you're talking about epithelial tissue, this is a type of tissue that basically covers body surfaces. Right now, you're looking at your skin. Okay, I'll ask you to look at your skin. Look at your skin. So that skin that you're seeing there has got epithelial tissue. If you looked at the integumentary system, you find that it has got different layers. There's the epidermis, there's the dermis, right? Then there's the hypodermis. So in the epidermis, you have got epithelial tissue that is lining or covering the skin. So basically, if you're talking about epithelial tissue, it's type of tissue that is covering the body surfaces or covering body organs. That is what epithelial tissue is all about. There's more to that. We're going to go into details. All right. Now, this picture that you are seeing here is just trying to bring about what I'm just from explaining from the previous slide, but just to give you a more practical, picture of what I was talking about. So, for example, let's just zoom in here. We're talking about epithelial tissue at this particular point. So let's just zoom in. We've got this particular individual who has got the skin. So if we zoom in on the skin, let's just get a piece of the skin there. We zoom in. This is how the skin looks like. Remember, I said it has got this hypodermis layer. There is this particular, dermis layer. Then there's the top of there's the top part which we call the epidermis layer. And I say that since epithelial tissue covers body surfaces, and the top part of the skin is one of them, because the top part of the skin is covering body surface. So it simply means that in this part of the skin, the top part of the skin is what we call epithelial tissue. Now, it's also important for you to know that epithelial tissue is just not all about covering body surfaces. It also lines internal body organs. So there are organs inside the body that are lined with specific type of epithelial tissue, and as we make progress, you find that each type of body organ has got a specific type of epithelial tissue because it must be able to perform specific functions, right? Another example I can give you here is that you know that we as human beings, we do sweat sometimes when it's hot. Sometimes because of maybe we're fighting and everything, we do sweat. We do produce sweat. So if you were to zoom in here, in this particular skin diagram, okay, in this particular integument diagram, you've got this sweat gland. It's like a sweat gland. What you must know that epithelial tissue, besides it covering body surfaces, besides it, lining different body organs, it's also part of what we call glands, what we call specifically endocrine or exocrine glands. So glands, of course, they produce mucus, they produce hormone and everything. What you must know is that when you're talking about the endocrine system, for example, the endocrine system, you must know that that system has to do with production of hormones and everything. So those glands that produce those hormones, they have got epithelial tissue. And to be specific, we call that type of tissue as glandular epithelium. We're going to cover that. So I need you to know that besides covering body surfaces, epithelial tissue also make up what we call glands, either endocrine or exocrine. For example, the sweat glands in which sweat is being produced. Okay, so sweat is coming from down there, produced in this particular integumentary system, and it's coming out on top there. So that's a sweat gland. For example, it can be a merocrine gland, it can be a horocrine gland, but what you have to know is that that gland is made up of epithelial tissue. So you've known that besides covering body surfaces, besides lining various body internal organs, epithelial tissue also make up glands, either endocrine or exocrine. This picture here, I know that you're already rushing. You want to know which one is squamous, columnar and everything. Hold on. This picture here is just trying to show you that this this epithelial tissue is lining different organs. For example, you can find epithelial tissue in the respiratory system. You can find one in the female reproductive system, for example, the vagina. We're going to talk about these things, okay? Then you're going to find also epithelial tissue in the kidneys, in the GIT, okay? There are different types of epithelial tissue that are lining different body organs. Just from these few concepts, I'm sure you've been able to see why it's so important for you to know epithelial tissue. Because imagine, you don't know, maybe something goes wrong with this particular, respiratory tract. Because what you have to keep in mind is that it has got epithelial tissue. And if something is wrong with this epithelial tissue, then something is wrong with this particular respiratory tract. Then the entire system is going to be affected. That's how the body works. If a cell is affected, then the tissue is affected. If the tissue is affected, then the organs are affected. If the organs are affected, then the systems are affected. And indeed, if the systems are affected, then the overall human being is affected. So let's make progress. All right. So by definition, we're saying that epithelial tissue is a type of biological tissue composed of closely packed cells arranged in continuous sheets that cover body surfaces. Okay, that's one of the functions. That cover body surfaces. They also line internal body organs and form glands. So if you're talking about epithelial tissue, one of the ways you can tell that this is epithelial tissue is that the cells, because we're talking about tissues, right? So we're talking about cells being combined together. So the cells, they look closely packed together like this. Okay? They look closely packed together. This is epithelial tissue. This is a cell, a cell, a cell, a cell, a cell. These cells are closely packed together, right? So it has got closely packed cells that are arranged in a continuous sheet. Because I told you to look at your skin. If you look at your skin, there's no space. There's no hole in between. It's continuous. It's smooth. It's because it has got epithelial tissue, which has got closely packed cells, which is continuous. And then this type of epithelial tissue, this epithelial tissue now can either cover body surfaces, it can line internal body organs, or it can form glands. That is what epithelial tissue is all about. Now, talking about the functions, remember I said on each and every type of epithelial, on each and every type of tissue, we have to talk about the functions. So just from the brief recap that I talked about, pause the video. Think about, from what I've said, what are the functions of epithelial tissue? One, protection. So we're saying that one, protection. Epithelial tissue form a barrier against pathogens. You know what pathogens are? Disease-causing microorganisms. Imagine if your skin was open up, you were cut, you had a wound. A microorganism, a pathogen, is just going to enter. But because your skin is continuous, it has got epithelial tissue, it's protecting you from those microorganisms being able to penetrate or enter the skin. That's why you say if somebody has got a cut or a wound, they can easily contract, microorganisms or viruses or bacteria because they are bleeding, they have got a cut. But the fact that your skin is protected, it has got continuous sheet of epithelia, you cannot allow the entry of pathogens, toxins, and physical injury. For example, the skin has got epithelium, which protects internal organs from pathogens. It's a very simple concept. So this picture here is just showing the skin. You've got the epidermis, the dermis, the hypodermis. Now, the fact that this skin is normal because there's no cut here, these pathogens can't enter. But here you can see down, if there's a cut, if you injure yourself, you've cut yourself, then these microorganisms can enter. So you can appreciate the fact that the skin, the epithelial tissue is bringing about protection from injury, from microorganisms, from toxins, as well as also just helping you in thermoregulation. Imagine without the skin, you would directly go into hypothermia, right? So this is very important. Apart from that, absorption. Absorption, yes, absorption. So epithelial tissue, remember I said it also lines various internal body organs. And then there's what we call the digestive system. When you eat something, it goes into the esophagus, from the esophagus into the stomach, duodenum, jejunum, ileum, in the small intestine is now there. That's where there's absorption. So what helps the food that you eat to be absorbed into the blood is the epithelial tissue, right? So absorption. So intestinal epithelium can absorb nutrients from food. If you zoom in there, we've got what we call small intestines. So in these small intestines, that's where absorption of food takes place. But what you have to know is that what makes that food to be absorbed or to make it possible is epithelial tissue. There's what we call a microvilli. Okay, so for example, this is a villi. Okay, it's just a component of small intestines. Okay, the component of small intestine, it's a villi. So this villi has got epithelial cells. These are epithelial cells that you are seeing there. At this point, I've not yet started talking about whether it's cuboidal, columnar, squamous, pseudostratified. No, I'm just generally talking about the functions. So if you zoom in on one of the epithelial cells there, you've got what we call a microvilli here. Okay, a villi which has got microvilli. These microvilli, they are the ones that ensure that the food that you are eating are being absorbed where? They are going into the blood. So you can see their capillaries there. So this epithelium is going to make sure that whatsoever you are eating, it's going to diffuse in this epithelium, then to be able to enter the bloodstream. Then the blood is going to have the nutrients and the food that you want. So epithelial tissue is bringing about absorption. Okay? Apart from that, secretion. Think about secretion. Hormones, right? Just to give an example, enzymes, right? So I talked about this epithelial tissue not just covering body surfaces at all, but also lining various internal organs. So for example, there's what we call glandular epithelia. I know I've not yet talked about this, but when we say glandular epithelia, we mean type of epithelia that is found in glands. Whether the exocrine glands, endocrine glands, it's okay. But that which is found in glands. Okay, glands, they produce hormones, they produce enzymes and everything. For example, the pancreas, the pituitary gland, all those kind of glands. So how is this epithelia or epithelial tissue bringing about secretion? For example, the glandular epithelial cells, they produce mucus. For example, you've got saliva that is being produced by the tongue. It's because the tongue has got glands, salivary glands, that are producing mucus. And those glands have got epithelial tissue. Just an example. Also, enzymes. You talk about the enzyme, for example, the pancreas. The pancreas produces what we call pancreatic juice or pancreatic liquid, which has got enzymes that are used for digestion. You find that is just lined with epithelia, that particular organ. Okay? Apart from that, hormones, a lot of hormones. We've got, different types of hormones that are being produced by different glands of the body. Okay? The adrenal glands, the pancreas, it produces hormones as well. The ovaries, the pituitary gland, the thyroid gland, different glands are producing hormones. What you must know that those glands, they are made up of epithelial tissue. That whole gland that is producing that hormone is made up of epithelial tissue. For example, here on this diagram, you find that in the skin, for example, we produce sweat. That sweat is being produced from the sweat glands. I said sweaty gland. So there's a wet gland. That gland is made up of epithelia, right? Also, in the endocrine system, you've got hormones that are being produced from the glands. And to be specific on endocrine glands, the very glands that we're talking about here, they're just epithelial cells which are combined together, forming epithelial tissue. It's just basically epithelial tissue that is producing hormones. Okay? There's also sensation. You're surprised, right? How does epithelia bring about sensation? You must know that some epithelial cells across body surfaces, for example, cilia in the respiratory tract. I think I'm talking about this particular point here. For example, some epithelial cells have got sensory roles. Some epithelial cells have got sensory roles, e.g. the taste buds. How do you taste things? This is bitter, this is sour, this is sweet, this is bad. It's because you've got taste buds. Those taste buds are lined with specific type of epithelia that will be able to allow you to be able to say this is not tasting good, this is tasting nice, this is tasting sweet, this is bitter, this is sour. It's because in those taste buds there's epithelial, specific type of epithelia that is facilitating or allowing you to be able to taste things. Even smelling things. Yes, it's because of specific type of epithelia that is going to line the nasal cavity. We call it olfactory epithelia. So in the nasal cavity, for example, here we've got what we call olfactory bulb. This olfactory bulb has got olfactory epithelia, which when you smell something good, of course you'll be able to tell. You smell something bad, a bad odor, you'll be able to tell. And this is very fundamental in the field of medicine, in the field of nursing, midwifery and everything. Because if your patient can't smell certain things, then of course they will be able to face challenges at some point. If they can't taste certain things, they will be able to face challenges at some point, because the sense of taste, the sense of smelling helps you to detect danger and everything. So it's important for you to understand that in these different organs or structures, you find sensory epithelia, such as the taste buds. To be specific, you can say on the tongue, they are what we call the fungiforms. The fungiform, these structures here, they have got taste buds which are able to detect whether something is sweet, bad, or bitter. Okay, so they also have the sensation part. Okay, last but not the least, we also have what we call this epithelia also allows transport of unwanted things. It could be wanted or unwanted things. Just to give an example, I'm just using the word transport in general. So they help remove substances across surfaces, e.g. the cilia in the respiratory tract. So if you look at the respiratory tract here, which is just part of the respiratory system, there's what we call the cilia. If we start classifying, you find that I'll be like the type of epithelia which is in the respiratory tract is ciliated. It has got cilia. For example, if you just by mistake you kind of breathe in dust particles, what do? You start coughing, expectoration. You start coughing up. It's because your epithelia or your epithelial cells in this respiratory system, they'll be able to kind of sweep this particular particle up the respiratory system, and then you'll be able to cough it up. So it will be able to help you to be able to transport unwanted particles in the respiratory system. So there are a lot of functions that we can talk about. There are a lot of functions, but that is on the functions of specifically epithelial tissue. Now, last but not the least, we also have to talk about the features, the characteristics of epithelial tissue. What can make you tell that this is epithelial tissue I'm talking about? Even in an exam question, what can make you tell? What is that which is going to help you in identifying that, oh, this type of tissue is epithelial tissue? So we call them features or characteristics. Number one, epithelial tissue is composed of closely packed cells. The cells are closely packed together. It's not like the way blood tissue is, no. Where you've got the red blood cells on their own, right? You've got the white blood cells on their own, platelets on their own. Epithelial tissue has got closely packed cells, like the way they pack, uh, uh, I can give an example of a pan of buns, right? You're able to find that they are packed like epithelial tissue, so they are packed closely together here. So one of the features is that epithelial tissue have got closely packed cells. Number two is that this epithelial tissue, for them to be closely packed together, for them to be very close to each other, to be very tight, it simply means that they have got tight junctions. Okay, so among the tight junctions, there are also what we call desmosomes, okay, which are here, desmosomes, and also gap junction that just ensure that these epithelial cells, they are closely packed together. Because, for example, if it's in the skin, you don't want your skin to be loose. You want the skin to be intact, making sure that everything is intact, everything is closely packed. It's because of these tight junctions, because of these desmosomes, and sometimes they are what we call gap junctions, because epithelia, it's also part of a living tissue, right? You also want it to be able to feed at some point, to be able to access nutrients, oxygen, and remove of unwanted products. So these gap junctions, they just facilitate the removal or transportation of wanted or unwanted products, right? Then there's also what we call the principle of porality. So we're going to say epithelial tissue has got the porality features. What do we mean when we say it's polar? It simply means that it has got two sides. It has got the top part and the basal part, or the down part. So, for example, if I show you this diagram, this is what we mean. So this particular epithelial tissue, if we say it's polar, let me show you this diagram. Let me show you this diagram, which is here. This diagram here. So when we say it's polar, meaning there's these two parts. Imagine as this being the top part of the skin that you are seeing right now. But there's something that you can't see beneath, right? That down part we call it the basal part. So the fact that it has got the apical part or the top part and the basal part, we say it's polar. So that is polarity. So there's the apical surface, faces the body surface or lumen, and may have cilia or microvilli. You saw when I was talking about the digestive system having in the epithelial tissue in the small intestines, you saw that the microvilli was on the top part, right? So it also has what we call the basal surface attached to the basement membrane. Okay, this is the basement membrane. A basement membrane is a structure that you're going to find between the epithelial tissue and connective tissue in between. I'm going to show you. All right. So epithelial has got what we call porality, the top part and the basal part. Remember I talked about it having tight junction. Just imagine this entire box as one epithelial cell, another one, another one, another one, four of them here. So they've got what we call tight junctions, they've got what we call desmosomes there, or zonal adherents. These structures, they just help to keep the cells tightly packed together. There are also what we call hemidesmosomes. You can see here, hemidesmosomes. So the hemidesmosomes, they just attach the epithelia to the lining connective tissue. Because after the epithelial tissue, you're going to find connective tissue down. Of course, I said before you go to the actual connective tissue, what we call lamina propria, there is what we call a basement membrane in between. But it's ensuring that this epithelial tissue is anchored into that basement membrane, also anchored or attached to the connective tissue down there. Okay? This is what I'm talking about. You've got one epithelial cell, another one, another one. Then in between, you're going to find tight junctions, of course. Then there's what we call a basement membrane. This structure here. Okay? The structure that is found, I don't know if you're able to see this clearly. Let me just do this. So there's there's a structure here that I want to show you. Let me just do this. Right. So there's this what we call a basal membrane there. Right. My pointer is misbehaving. Pointer is misbehaving. Doesn't want you to learn. Alright. Let's do that. Okay, just pay attention. So there's on this particular diagram here, look at on what is written as basement membrane. So this basement membrane is a membrane that you find between the epithelial tissue and the connective tissue. Connective tissue is the one down there, right? So there's what we call a basement membrane. It has got what we call the basal lamina, which is coming from the epithelial tissue, and what we call the reticular lamina, which is coming from the connective tissue. And then collectively together they form what we call the basement membrane. Then the actual, because after epithelial tissue, you find the basement membrane, then the connective tissue, also referred to as the lamina propria. So that is the structure that I wanted you to know there. Okay? Then apart from that, there's also the concept of what we call avascularity. So what do we mean when we say avascularity? What we mean is that if you are talking about epithelial tissue, it's not lined with the blood vessels at all. It's not lined with the blood vessels. No wonder we say it's the avascularity. Okay? It's avascular. So if you ask yourself, if it has no blood vessels, then how does it feed? It feeds, how do the epithelial tissues have access to nutrients, oxygen, and removal of toxins? It's through the principle of diffusion. Okay? Through the principle of diffusion. Apart from that, epithelial tissue has got what we call high mitotic capacity. They're able to regenerate very fast. For example, the skin, after 14 days, it's going to be scraped off. Other cells are going to be replacing the dead top part of the skin or the keratin part. It's because these epithelial tissues, they are highly mitotic. They undergo mitosis at a very high rate. Okay? So they keep on being replaced. Any question? So after what I'm going to show in the next slide, okay, like here, you have to have the many groups of epithelia or classification of epithelia. There is what we call covering epithelia, okay, which just covers or protect various body organs or surfaces. There's what we call glandular epithelia, which is just made. This is a type of epithelia which is making up different, glands. They could be endocrine glands. They could be exocrine glands. We're going to talk about that. But these are the main categories of epithelial tissue. So in the next video, I'll talk about what you need to know with respect to whether squamous, epithelia, simple epithelia, all right, what we mean by those different terms. I know you are anticipating that. So make sure that you subscribe to this YouTube channel so that you don't miss the